different points of view on this issue. They're each going to take about 30 minutes to do their presentations, and then we're going to have 30 minutes of questions. For questions, we ask you to write your question on the piece of paper that is on your chair. We'll have folks coming around. If you've got it written, just hold it up, and we will be sorting them. When we sort them, frankly, we're going to look for questions that haven't already been covered in the presentation, something new and different that we haven't heard about already. We'll try to get to as many as we can, but in the time allowed, we probably honestly won't get to all of them. So we're going to do our best to give a nice, balanced, fair set of questions. On the questions, we're going to ask each of our speakers to take about 2 minutes to answer the question, and then our other speaker gets another couple minutes to comment on it if they would like to. So that's the process that we're going to go through tonight. So we have, as I said, two terrific folks to talk about this issue, about health impacts and wind turbines. First, we have Dr. Robert J. McCunny. Where'd he go? There he is. Dr. McCunny is an internist who is board certified in occupational and environmental medicine. He has completed training in internal medicine at Northwestern University in Chicago and in occupational medicine at the Harvard University School of Public Health. Dr. McCunny is a regular guest lecturer at Harvard Medical School, a member of the clinical faculty at Harvard Medical School, a research scientist in biological engineering at MIT, and a clinical associate in pulmonary unit at Mass General. At MIT, Dr. McCunny lectures in public health and occupational epidemiology and conducts research in occupational lung disease. At MGH's pulmonary unit, Dr. McCunny evaluates potential occupational and environmental illnesses among patients referred to him. Dr. McCunny is past president of the American College of Occupational and Environmental Medicine and an accomplished author. He has edited numerous occupational and environmental medicine textbooks and over 80 published articles and book chapters. Most recently, the third edition of his textbook, A Practical Approach to Occupational and Environmental Medicine, was published in 2003. Royalties from the book benefit the Samuel E. Bacon Research and Education Fund of ACOEM. So that is Dr. McCunny. We also have with us Dr. Michael Nissenbaum. Dr. Nissenbaum is a radiologist who did his undergraduate training at McGill and attended medical school at the University of Toronto. He received diagnostic imaging training, including medical physics, at McGill University and did a fellowship at the University of California in MRI under American MRI pioneer William G. Bradley, physician and PhD. Dr. Nissenbaum was Associate Director of MRI at Beth Israel Hospital in Boston under Robert Edelman. Dr. Robert Edelman, developer of MRI angiography and other advanced pulse sequences. At the time, he was a junior faculty member at the Harvard Medical School. Currently, Dr. Nissenbaum is trying to raise a young family in the wilds of northern Maine, as radiologist at Northern Maine Medical Center. So those are the two really terrific guests we have who come really a long distance to help us tonight. If you would just welcome them both, please. And with that, I'm going to turn this to Dr. McCunny and ask him to do his presentation.
Thank you very much, Tom. It's a pleasure to be here. Before I get started, though, I want to make sure that people have an understanding of my own background and how I ended up here. As Tom indicated, I'm a specialist in occupational and environmental medicine, which is a specialty in the American Board of Preventive Medicine concerned with understanding potential health implications of exposure to occupational and environmental hazards, Canadian Wind Energy Association. In this group of 7 people, we were asked to review the scientific literature and prepare what's called a white paper. But I want to emphasize that I'm here tonight speaking on my own behalf. I'm not representing any particular organization. I certainly don't have a particular strong feeling one way or another, pro or con, about wind turbines. My main concern is really trying to look at the published scientific literature to see what has actually been done in terms of research with respect to people living in the vicinity of wind turbines and where good studies weren't available, to look at some of the experimental studies that may have been done in other settings that might be appropriate to answer some of the questions, frankly, whether living in the vicinity of wind turbines may adversely affect human health. I want to emphasize that I haven't done any primary research here on this particular topic. What you're about to hear from me, though, is a summary of what is out there in the medical literature, so that if any of you took on the same tasks that I did along with this other group, you would come upon similar information. With respect to wind turbines and with respect to any type of occupational or environmental hazard, one is always looking at the potential relationship between two major factors. And that is one, whatever the exposure may be, whether it's asbestos, silica, coal, or whatever, and some human health effect. Now, clearly here in this situation, we're concerned with primarily noise and various dimensions of noise and whether it can affect human health. Now, from wind turbines, there's two major types of noise. There's both mechanical noise from the gearbox and control mechanisms, and there's also the aerodynamic noise, the so-called swish-swish sound that is generated by the turbines turning themselves. Now, I think to set the stage for trying to understand some of the studies and some of the concerns about wind turbines with respect to noise, and noise clearly is the major area of concern, I think it can be helpful to look at some of these measurements as to how sound is actually measured. Sound is essentially made up of two major components. One is the frequency. Low frequency, for example, would be the type of sound that one would hear next to a bass guitar or a bass speaker. High frequency might be birds and chirping and young children's voices. So sound is essentially characterized by its frequency and its sound level, which is really decibels. Many of you may have had hearing tests where remember when you sit in the booth and the audiometric technician will change the frequency and then raise the volume of the frequency until you actually hear it and then you raise your hand. So remember that sound is made up primarily of its frequency and the various volume, when the volume is measured in decibels. Now, as you can see here, jet engines have considerably high levels. These are 140 decibels. And I realize that it may be a long time that many of you had from high school math, but the decibel schedule is logarithmic, which means that if you go from 50 decibels to 60 decibels, you're actually doubling the noise intensity. Similarly, when you go from 60 decibels to 70, you would be doubling the noise intensity. So you can see here that jet engines are about 140 decibels, and as you go right down to busy restaurant, about 78 decibels, speech about 50 to 70, and a whisper about 30. Now, according to environmental impacts of wind energy projects from the National Research Council of the United States, areas near wind turbines generate noise levels between about 35 and 45 decibels. And I think it's important to emphasize that the risk of hearing impairment, and this is basically based on results and studies from the National Institute for Occupational Safety and Health and many organizations, that unless you're continually exposed to noise levels greater than 80, there really isn't much of a risk of hearing loss. In fact, there's no appreciable risk of hearing loss from living in the vicinity of wind turbines. Now, according to the National Research Council, I want to set some of these numbers up for you so you have some understanding of what normal noise levels are from customary activities and also noise levels from wind turbines so you can have some sort of qualitative comparison. According to the National Research Council, the sound power from a single wind turbine is usually around 90 to 105 decibels. To give you some idea of what that might mean, if we were in a factory, for example, and I had to raise my voice to talk to you about arm's length, you're probably at about 85 decibels, to give you some idea of comparison. Now, this type of a turbine would create a sound pressure of about 50 to 60 decibels at a distance of approximately 40 meters. 40 meters would be about 45 yards. And this is the same as conversational speech. Noise pressure levels from an onshore wind project are typically in the 35 to 45 decibel range at a distance of 300 meters. And these is information from the National Research Council. To give you some perspective on various frequencies, I think it's important because one of the concerns that has been raised about potential health implications of living in the vicinity of wind turbines is that as the frequency of the noise actually gets lower and lower, that there's higher and higher vibration levels, and some of these vibration levels may be potentially hazardous. So with that in mind, keep these sort of points together. Speech frequency is about 500 hertz to 20,000 hertz. There are some variabilities among people. Low frequency is about 200 to 250, although this definition is somewhat flexible. And also infrasound. Infrasound is anything less than about 20 hertz. Now, there are essentially three different types of sound that can be emitted by wind turbines that have received attention. One is infrasound. Infrasound is less than 20 hertz. Now, by and large, most people don't hear infrasound. Infrasound can be audible, however, if the noise level is high enough, but for the most part, infrasound is inaudible. Low frequency sound is approximately 10 to 200. As I said, these definitions may vary, but fundamentally in this range. And there's also the fluctuating aerodynamic swish sound that people report who live in the vicinity of wind turbines. And this sound is in the range of about 500 to 1,000 hertz. And I think